Actually, good afternoon. And now, actually, I came in front of you to present a novel approach in homeopathy. Actually, like usually, we are having many protocols in homeopathy, which mainly focus towards like metromedica, where you want to select a remedy, how to prescribe, when to prescribe, what and all. Now, with the use of this hidden protocol, which we have implemented, we are selecting the tool in order to standardize the homeopathic prescription and homeopathic case taking. And we mainly aim to give a particular specified protocol towards case taking and where to follow in that case for the patient, how to treat, when to treat, and when you want to refer, and etc. for that. And by the hidden protocol, we assess mainly 6 parameters. One is health assessment tool, then intensity of the disease, duration, drugfulness, extent, nature of the disease. And in health assessment tool, we will consider all the health parameters like physical generals, mental generals, and past history, all those things. Followingly, we will analyze the case. Usually, we will ask the patient itself to do this, and the grading is given as 0, 0.5, and 1 is markings, and altogether we will add it up, and we will call it as hidden protocol value or the score. That's called RK protocol. With the help of RK's prognostic assessment, we will assess the case. You can see over here, the gradings are given from 6 to 10, 11 to 15, 16 to 20, 21 to 25, 26 to 30, and 31 to 36. The highest grading is 36 and the lowest one is 1. Beyond 1 or below 1, we cannot go, as it is like the patient is coming in front of you, not the healthy physician, healthy individual. That's why it cannot go below 1 and below 1. And when you are seeing it level 1, for example, we are getting the patient with a factor of, we can take a 9. Over there, most probably the pathological symptom will not be able to, or will not be required. We just want to need the symptomatic analysis or the symptom similarity is required over there. Improper symptom similarity. Then followingly, when it is going to next stage, we need to consider both the symptom similarity and pathology. Followingly, coming on next to that stage 3, we will consider symptom similarity, pathological similarity, gene ID, and poster correction. All those things will consider. By gene ID, we will include the miasmatic analysis, the indisposition, and susceptibility of the patient. And towards going for stage 4, we will consider along with that RK's prognostic assessment. That is this thing. Then that's the HB score assessment. That is hidden protocol score assessment, where higher the score is, poorer the diagnosis. If it is going above, like if it is going towards 36, is bad prognosis, and if it is less, it may or may not require treatment and the other things. Then level 5, where we are introducing a methodology of triangle. Actually, it is phase 1, so I have not included this over there. Methodology of triangle includes grouping of the patient into the society and finally analyzing to the stage. So analyzing to the remedy, we are having three triangles actually. Initially, we will group generally classify, then we will classify the patient symptoms along with ailments from extent, then where the affection is there, whatever be. And towards the third, we will go for individualized search of the remedy along with sphere of action, then towards the kingdom affection and all those things. And 20 going on the last one, we will assess along with adjuvant medicines. All those things after moving to 4th, 5th, and 6th, we will along with that we will consider or we will keep in mind whether the remedy alone is required or whether we have to think about surgical management or whatever when we want to refer and those things. And by this protocol, we are mainly aiming to standardize. As you know, nowadays there are many protocols available for us, but none of us gives us what to do next or what will be the prognosis of the patient. All those things we are allowing to get over here. Also, like a patient is coming in front of you and he is coming with prescription from some another and follow-up is there. But why he has prescribed? That's the question over there. When we are doing the thing with our protocol, we will get a group of remedies which we can see or we can analyze why it has been prescribed to that particular patient over there. As a result, we are trying to help the freshers who needs a confidence prescription, or at least what to prescribe or when to prescribe, uh, sorry when to prescribe and when to refer the patient. That's also one of our aims.